Hello, I'm William Huang, Medical Director of the National Cancer Center of Singapore, as well as a Senior Consultant in Hematology at the Singapore General Hospital. I would like to talk to you about cell therapy. We used to have drugs, and we still use drugs. And these drugs are usually single purpose, a tablet that you take or injection that you get. They're limited by a short half-life of the substance, but you need continued administration of the drug, otherwise the effect is gone by a day. Antibodies usually have single purpose. They can last longer and the effects can last a few weeks to a few months, but you still need repeated administration of the drug, otherwise the effect fades away very quickly. Cells, however, can be given and they can be equipped with multiple functions. And these cells have a potential to last for years after the infusion. A single administration can last almost a lifetime of an individual, potentially. It is what I call the gift that keeps giving. Now, these cells can have multiple functions. One, they can have receptors to recognize other cells and pathogens. They can also go and replace damaged cells and tissues if that's the function they're supposed to serve. They can produce proteins, cytokines, and enzymes for cell repair, immunomodulation, and metabolism. They can also do intercellular transfer to transfer tunneling nanotubes and exosomes to other cells to contribute substances towards their growth. Now, part of cell therapy involves the use of immune cells. We can infuse these immune cells to a patient and use these immune cells to attack cells that we don't want, for example, cancer cells. And you can see in this representation, these immune cells called T cells surrounding a cancer cell and slowly attacking it until it is destroyed. These T cells are like policemen. They go around the body looking to see if a cell is behaving well or not behaving well. If it's not behaving well, or if it looks like it doesn't belong there, these immune policemen, these T cells, will destroy the cancer. One classic example of the use of these immune cells is in this thing called CAR T cells. CAR stands for chimeric antigen receptor. And these chimeric antigen receptor T cells have a modified receptor on their surface that helps them recognize the cancer cell and brings them, and when they see the cancer cell, they know that this is the cell that they should attack. And this was used to treat acute lymphoblastic leukemia. And the classic patient is this patient called Emily Whitehead, who had relapsed leukemia that relapsed after chemotherapy and transplantation. But with CAR T cells, she was able to beat her leukemia, and actually she continues to be cured of her disease. And the role of these immune cells have also been explored for other cancers using other techniques. These are the use of tumor-infiltrating lymphocytes, immune cells that surround the cancer cell. You take them out, you grow them out in culture, and you put them back to the patient. And in this case of a patient with relapsed breast cancer, she was able to achieve control of her disease with these tumor-infiltrating lymphocytes. This is just preliminary results, and they have yet to be replicated in a large scale, but these are exciting findings for cell therapy coming up ahead. More to come next time, but for today, I thank you for your time. Thank you.